We've been suffering an opioid epidemic throughout the entire nation.
The opioid epidemic is one of the biggest public health challenges we face.
The RX Drug Safety Coalition is made up of community members, community-based physicians, law enforcement personnel, EMS providers.
All with the common goal of decreasing the effects of the opioid epidemic on our communities.
We as a coalition are focused on a few key areas. The first is safe prescribing of opioids. Working with local doctors and pharmacists, we've been able to reduce the number of opioid prescriptions in Placer and Nevada County.
Medication-assisted treatment is the delivery of medications to help someone maintain their sobriety. The number of providers that are able to prescribe these medications has gone up in both Nevada and Placer County.
One of the major focuses for our coalition has been to increase naloxone distribution throughout the county. It's a medication that basically reverses the effects of a narcotic overdose. Law enforcement and EMS have been able to save countless lives throughout the community. Now our efforts are geared towards increasing the availability throughout the county to include community members, even those that may have loved ones that are addicted to narcotics, so that they also have access to the medication.
Another element of the coalition's work is community outreach and messaging and education, and a focus of that is youth prevention. We know that youth often obtain narcotics from friends or family, and so we want people to be aware that they need to lock them up properly and also to get rid of them. We've made good progress with decreased prescriptions, increased access to care for people with opioid use problems, but there's a lot to go. And we've seen 3 waves in the opioid epidemic. It started with prescription drugs, and then we saw a rise in heroin, and most recently a very dangerous problem with fentanyl getting into our community.
We as a coalition will continue to fight this epidemic. We will continue to be the hope.